Breast augmentation is the most requested form of plastic surgery in the U.S., passing liposuction. For years, there were concerns about the long-term safety of the implants, but advances in technology are making the surgery safer. And as Channel 2 anchor Rachel McNeil explained, there are also new options for women who want a more natural look.
When I look at myself, I'm happy.
After the birth of her second child, Audrey Villafranco was ready for a different look. She enjoyed the fullness pregnancy gave her at the bust line, but after baby, well, not so much. So she came to plastic surgeon Dr. Kane Linville with a pretty specific idea of what she wanted, or rather, didn't want.
I was trying to stay away from that big fake look.
The current trend is that bigger is not always better, and women are coming in asking for smaller implants that more naturally fit the curves of their body.
Dr. Linville says whether it's a mommy makeover, breast reconstruction, or replacing older implants, women led the charge for a new generation of silicone implants.
There is some new implant technology that's come out just within the last year or less, and this has revolutionized the field of breast augmentation, really.
There are 3 new types of so-called gummy gel implants. The most cohesive gummy bear implant gives the most projection or extra cleavage. The responsive is a more natural feel and look. The soft touch is the best of both worlds, softer and most natural looking.
And the exciting thing is that we can now talk about how do you want the implant to feel. The implants, that's something we've never been able to do before.
These new innovations with breast augmentation are more than just about aesthetics. It's about safety too.
The cohesive nature of the implant means that the silicone sticks together just like if you cut through a gummy bear. So what does this mean? It doesn't leak out into the chest. It really doesn't have a reaction with your body. So it's much safer in terms of its profile. The shells themselves are even much better than they used to be. They don't break. They're very difficult to break or fracture.
These new FDA-approved implants are expected to last longer than older generations, meaning women won't need to replace them as often as previously recommended. Audrey says she now has confidence in her new look and peace of mind in her choice.
Not very many people can tell, so the people that do know, say I look very natural, and I've gotten plenty of compliments, and everybody wants to come see my doctor now.
Rachel McNeil, KPRC, Channel 2 News.